The NHS has been a thorn in the political side of every government that I can remember. The sacred cow that cannot be touched. Dare you say a bad word, you be castigated. Well, Wes Streeting, our new health minister, has been making the right sound bites. So I was expecting that now he's in government, that he would come up with something far better than this. A 10-year plan to save the NHS. For starters, the wording is wrong. It's psychologically brainwashing us into believing that Labour need 2 terms in office to complete the job. Well, I'm not giving any of them 10 years. We need solutions now. That's no good for people who are sick and need help right now. So what is his solution? Smartwatches. Are you having a laugh? Seriously, Wes. Under a 10-year plan, many will be given smartwatches to track blood pressure, glucose spikes, and the watches will even monitor how cancer patients are responding to treatment. Now, here's a bit of what the Health Secretary had to say when he spoke to GB News this morning.
We've seen more money and more staff poured in, but without the reform. And I think the lesson of the last Labour government that delivered the shortest waiting times and the highest patient satisfaction in history is that it's investment plus reform that delivers results. And that's why a big focus of me, the Chancellor, is about how we make sure that alongside any investment that goes in, we improve the productivity of the system. There will be a big focus in the budget around the investment in things like capital and tech so that we can make the system more efficient. But even where we're doing things like the 40,000 more appointments every week, that will also be achieved through reformed ways of working so we get more bang for the buck, because people are feeling the pinch in their pockets at the moment, and right across the public sector we've got pressures. So we can't just keep on pouring more money in without reform. That would be a waste of money we don't have and a waste of time that we don't have as well.
So it was a great plan. Smartwatches. I mean, this has completely missed the point. In 10 years, we'll probably all naturally be wearing our phones on our wrists, which is what we'll probably be doing. What he's actually proposing is spending taxpayers' money on something most people will buy anyway to track conditions, and that will still be putting on waiting lists for treatment. It's all very well knowing how high your blood pressure is and all those kind of things, but the problem is getting the treatment, and the treatment that will fix it. All the devices packed on apps are already available in any case to do that sort of thing. It's hardly groundbreaking, and as you know, a lot of this is happening anyway. His plan is that people will be treated at home, but that's pretty much where we are now, because people at home are dealing with ailments alone because they're on a waiting list that has over 7 million people on it. How will this be any different? Well, Wes said our 10-year health plan will turn the NHS on its head, transforming it into a neighbourhood health service powered by cutting-edge technology, so I presume that's the smartwatches, that helps us stay healthy and out of hospital. We will rebuild the health service around what patients tell us they need. Really? Most patients on the waiting list know what they need. I'm sorry, Wes, but this claptrap is just ridiculous. You haven't got 10 years anyway. I want to see your 5-year plan. This is all just an excuse. It's smoke and mirrors to get out of being called a failure in 5 years. Wes wants to move care from hospitals to the community. Well, they practically are in the community, because patients are nursing issues at home with support for friends and family. So there's not really any change there. He's planning Fitbit-style devices which will be given to people who have had strokes, and smartwatches will monitor tremors for those with Parkinson's. But that kind of happens in many cases anyway. There will be far less reliance on GPs. Again, no real change there. A lot of people are now going private or using private doctors. The local GP practitioner type thing is almost already becoming obsolete. I mean, you try getting an appointment, Wes. I'm sorry, but I'm not buying this at all. This is all very reactionary, not proactive in the slightest. It's not really dealing with the actual issues, is it? How are you going to cut waiting lists? How are you going to change the structure of the NHS? And in particular, what about the ridiculously bloated structure of managers? How much is all of this going to cost? In my view, he hasn't addressed the actual issues. Of course, technology should be used, but unless there is root and branch reform, a phrase I'm pretty sure he coined, the NHS will continue to be a black hole. All right, let's talk smart watches. Joining me now about Labour's plans for the NHS is Dr. Basha Mukherjee. She's a junior doctor. All right, so what are your thoughts? Smart watches. I mean, is this some groundbreaking solution? Aren't we doing something like this in any case?
I think what you said, Nana, was very true, that we already have the technology. I'm curious to see how Wes Streeting is going to actually unify this technology and reduce the burden on essentially humans, which is what Labour are trying to do. They're trying to incorporate technology so that we are less reliant on physical humans. But regardless of this, regardless of using technology, there is going to be reliance on doctors, nurses to interpret these results. So I'm curious to see if he's got a plan to actually collect this information from the smartwatches that he's planning to roll out. And if it's going to go into a central system, maybe using AI to interpret it, to alert doctors to naturally book an appointment, book a follow-up, book a scan or something like that after interpreting these results. That relies less on somebody going through paperwork, entering more data into a computer. I'm curious to see if that's what he has got planned, because that's truly what we need. We need less reliance on physical humans doing this, because we know humans is where we get the human errors, essentially. And if we can bring in technology to cut that red tape, which is part of the Labour pledge, what they made before they came into power, I'm really curious about that.
But I think we're all curious about what he's going on about, because, frankly, even if you have all this diagnostics and you cut out the middle humans, as it were, you still need enough beds, enough hospital spaces, you still need all the technology to power everything, and you need to solve bed blocking. Now, I'm not hearing him talk about those things, and I want to know that. To me, this sounds like smoke and mirrors. No?
Yeah, I 100% agree in terms of the numbers of beds and availability on waiting lists. But we must acknowledge the fact that a large part of the problem is the amount of admin load that is there on the NHS, the amount of steps there are to just getting a referral through, the referral reaching the right body, the referral then being read through and vetted, and then the appointment being given to patients. So if some of this unnecessary workload can be reduced through technology and sped up, I can see that this would speed up the process of waiting lists and patients being seen quickly by secondary care much more. Equally, I want to say that I think there is a benefit to using technology which is in the hands of the patients. I suspect that I don't know if this is what Wes has in mind, but if I was in his position, I would try to make a society which would be better at knowing their own body. And if that means they're using technology where they can recognize where something's wrong with themselves and act on it, I think that is a positive, working towards a positive direction. I'm not sure if that's what Wes has in mind, though.
I think a lot of us are very curious about what he has in mind. Dr. Basha Mukherjee, thank you very much. Very good to talk to you.
Thank you.